Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm really excited that you're here. And we have another phenomenal guest with us today, Lisa Balint, who is an expanded practice dental hygienist working on Capital Dental's community outreach team. Lisa obtained a Bachelor of Science in Dental Hygiene from Oregon Institute of Technology in 2021 and her Master's in Public Health Practice at Oregon State University in 2023. Congratulations, just a year. Actually 2 years ago now. She's committed to enhancing oral health in underserved rural communities by providing evidence-based care, medical dental integration, which I just can't wait to talk about, and applying principles of public health. Lisa, thank you so much for being on the podcast.
Thank you so much for having me. I appreciate you having me come on here. It's great.
You are doing one of my favorite things in the world, which is working hard to provide positive change in the health of our patients. And so the way you do that is very different than the average sort of like hygiene dentist relationship. So could you talk a little bit about your role in dentistry and how you're looking to expand the roles of hygienists and elevate the care that patients receive?
Yeah. So I operate out of Oregon. I have an expanded practice permit and I have a collaborative agreement. It's a board certified document, a formal agreement with a dentist. Between these things, this allows me to go out into the community and provide dental hygiene services without a dentist present. And I work in multiple environments alongside a team that is in just a variety of different areas. When it comes to medical dental integration, we are in primary care, family medicine, pediatrics, at clinics. We are at even doing some piloting at rural hospitals around the state. We're at behavioral health clinics, substance use disorder clinics, quite a few different partnerships, which is fantastic. As a hygienist, I work as a mid-level provider, which I know is a little bit of a different model where the office is centered around the care that the hygienist provides. And then our dentists are treated as a specialty. And so our hygiene is focusing on that preventive care, dental hygiene services. And then we are the data collectors. We're doing radiographs, we're doing intraoral imaging, and we're taking all of that included with our assessment. And then we're submitting that to a teledentist in order to complete our comprehensive exams. However, if there's some patients that have obvious signs of decay present or needs that need to be addressed in person, then we're connecting them with a local office. But our main goal is to reduce barriers to care. And one of the greatest barriers in Oregon is geographical barriers, transportation barriers, because I think 30% of Oregonians are considered rural, and it's a huge factor.
Yeah, I want to highlight a couple things and ask a couple questions based on what you said. Because I talk with a lot of dentists and a lot of dentists who are involved in technology. And number one, in my mind, a lot of dentists are thinking this is some space age weirdo. It's teledentistry stuff that I don't get involved in, which absolutely not. I think this is way easier than what everybody's saying. All you need to do is be able to share a radiograph, which certainly through the apps or any other platform can do easily. This is not space age weirdo having to have a camera on the hygienist's head while they're doing an exam or whatever. And secondarily, I want to highlight an interaction that I had that I think is pervasive in this industry. And I would think that, especially based on how you said what you do, I would think that you've run into this issue before. I was talking to one of the really prominent dental technologists who talks about technology in dentistry, lectures all nationwide. Most people who pay attention to technology know this person's name. And we were talking about, because we have a teledentistry platform, as a lot do at this point. During COVID, we were one of four, so it was bonkers. But this person came to me and they said, what I don't like about teledentistry is going to make it so that a hygienist can go out to a rural area, see a patient, and then if there's an issue, refer them back to me. And I like a hub and spoke model. And I said, well, isn't that exactly what should happen? Because are you going to go out to this rural area and see the patient? And he said, no. And I said, then what the hell's the problem? Not only do you not have to pay this hygienist in your office to like basically not be a revenue source at this point, particularly because hygienists are so much, but all they're doing is out there feeding you patients with needs and reaching some of the 50% of patients that don't see a dentist every day or every year. So this hub and spoke model, I think, is incredibly needed in dentistry for not just geographic, but just to reach people that don't see a dentist today, which is half the population. When I got out of dental school 25 years ago, oh my God, I'm aging myself. Half the population hadn't seen a dentist in the last 18 months. Today, it's half the population. So what the hell are we doing about it? But I've run into resistance by people who are very technologically savvy that know the industry. So are you running into that same sort of resistance as you're walking around talking about what you do?
I'm walking around talking about it, yes. Absolutely, I receive that resistance. However, when we present about our teledentistry and we show them, we bring those radiographs up on the screen and we bring up the intraoral imaging to the highest level that I'm able to take them and see how well they can really scroll in. You can't do that with someone's mouth. They're really able to see so much more than they think that they can realistically. And between that and having that paired collaboration with your hygienist, it's extremely helpful. And beyond simply that, something that I like to clarify that's super helpful for teledentistry for our dentists is we are essentially triaging those patients that maybe don't need to go in your chair as well. So we are increasing your productivity in a way because we are removing those patients that aren't requiring restorative care. And you're able to, our teledentist is able to complete those comprehensive exams quickly. And then we're able to then get patients that really need that restorative care right into the chair. I know for us, we have a workforce shortage, and this has really helped with that, is those patients that are regular, that don't show any signs of cavities present, that haven't had a cavity in their life, that children that nothing's of concern, we're able to quickly and efficiently get through those comprehensive exams in a just as good manner as in person. But then that opens up seats at our dental offices as well. So we're reducing costs. We're not having to pay for locations for me to be at. We're partnering with locations to set up sites on site, which is super helpful. So it reduces costs and increases efficiency for our dentists.
That's great. So can you share a success story or memorable experience that highlights how that works?
Yeah, let's think about this for a second. So one of the stories that I can think about is I prepped one that I was thinking about beforehand that I was like, oh, this would be great for medical dental integration. Let me think about like the teledentistry version. All right. So I had a wonderful patient that I had met for the first time, and I work in a medical office. It's a family medicine, pediatrics, internal medicine office. I have my own little chair there, full operatory. And I run that office on my own. And as patients come in to see their pediatric provider for a wellness child visit or acute visit, and the physician notices that there is a need for dental, maybe they haven't seen a provider in the last year or 6 months, or maybe they have a concern when they're just going through the regular exam, then they'll come over to me. So I met this patient for the first time. It was during COVID. So we were doing our evaluations before we bring them back, the quick questions everybody had to ask. And as I walk out there to go ask our pre-COVID questions, the little sweet boy that came up to me was like, my dad just passed away. And mom just becomes very apologetic. She's, I'm sorry, my husband made all appointments and I just came. And in the midst of that, she's telling me how they had just moved here from out of country and language was a huge barrier for her. And she was scared, but she knew her son needed care because she could see holes in his teeth and they were black. And so I remember just feeling this huge impact on me of I need to do something here. The only reason we caught this case was because we were integrated into a medical environment. We were going to where the patients are. She wasn't going to call the dental office and go in herself. That was too overwhelming, right? So I bring the patient back. We're able to take x-rays, really high dental anxiety. This child had really experienced some difficult trauma recently. And between that and just never being at a dentist before, it was just very overwhelming. I introduced him slowly in our little hygiene practice of showing him toys and introducing stuff that show you how dental works. And then we were able to get full x-rays and images and then send that to the teledentist. Now, a lot of these cases, I send the teledentist so that she can essentially triage it first, right? Who this going to need to go to? And it was identified that this case would require general anesthesia. Unfortunately, that's our last resort. But with this case in particular, it just was the best option. But we were able to get that patient the care that they needed, and they were able to complete all of that. And not only that, if a child has teeth that are in a significantly poor state, then mom does too, maybe sibling. And that was the case. So we were able to also complete teledentistry visit for mom and little sister.
That's great. So I want to ask you a question because I'm working hard now on this, like you said, medical dental connection, right? And I feel that it's a very misunderstood area and like tragically so. People think, why can't physicians and dentists work together? Meanwhile, they don't even send an x-ray when they're referring a dentist to an orthodontist or an oral surgeon or an endodontist. So we have to start with interoperability within in dentistry, but connecting our systems and connecting our enhancing collaboration between medical and dental is crucially important for the care of patients like you're describing. However, when I talk to physicians, they think dentists should just do what they tell them to. When I talk to dentists, they say every physician should know all in the entire comprehensive dental history of a patient. And neither one of those things are true. I believe that the dentist needs to pay way more attention to the medical history of a patient than the physician needs to pay of the dental history. Although there are obviously some crucial elements within dentistry that physicians need to be aware of. And also, we need to be able to have collaboration with our physicians, just like we do with specialists, and connect our systems, which is what we're hard at work at do that on. So as I'd say boots on the ground person who's straddling between medicine and dentistry, do you agree with that assessment? And what can dentists and hygienists and mid-level, I think it's misunderstood, like mid-level providers, what can we as dental professionals do to help our patients because I think what you mentioned for this child being screened within a medical practice, then being sent to a dentist that's where the physician's place ends. But knowing that the medical patient history of that patient is vitally important for the dental care. Do you agree with that?
Absolutely. And like I said, my office is actually in the same hallway as the pediatric hallway. I'm primarily working with physicians, nurse practitioners on a daily basis and their MAs. I'm not always working on the dental side. I am the dental side for that and my teledentist is and my local brick and mortars as needed as well. But yeah, I am working with physicians daily. So what I do is I run a full hygiene column. So I'm doing dental hygiene services and teledentistry. But in addition to that, my physicians that I work with know that if they just knock on my door, I can pop out for just a couple minutes and I can complete a screening for their patients. So sometimes I think our physicians are just super busy. And so they're like, I don't need more to add to my time. I've got this amount of time to work with patients and then I need to get to my next patient. And they're nervous that doing some kind of integration is going to be a burden on their schedule. I have found it to be the opposite. We are taking something off of their plate. I go in there, it takes me like 2 minutes to do a quick screening, apply fluoride, talk about their chief concern, grab their information, and then set up a time to call them to get them connected with the care that they need. Whether that's just quickly scheduling with me, which I hand them a little referral slip, they go right to the front and schedule, or it's calling them and saying, hey, I think it might be best for you to go in office. Let's go ahead and start coordinating that. I have had no poor feedback from that. My physicians that I work with are extremely thankful for being able to have a hygienist and dental on site. I think that's what makes it more successful. Unless you're in that space, it's easy to see that it's not gonna work. That partnership is we're just two polar opposites, and I'll just refer to you and you refer to me. But having that in between is extremely helpful. They call me their care coordinator as well. Anytime that one of their patients they get alerted for an ER report that they've been in for dental, I get a flag sent to me through their electronic medical record, and I am able to triage that. Anytime a patient comes in with something that the provider hasn't seen before in the mouth, they'll knock on my door and go, Lisa, do you mind popping in for a second?" I think
Okay, I have to stop because you talk about a piece of paper referral and knocking on your door and going separately into the EMR and the patient record, the dental record. I'm like, this all this stuff we can solve.
there's a lot. There's a lot.
The logistics of how you're doing this can be optimized way more. So talking to me about that is driving me a little bit crazy, but I love the spot you're in because both industries, medical and dental,
Yes.
need to get into the 21st century, right?
Oh, absolutely. And
Yeah.
something that Capital Dental Care is doing is we have started to integrate electronic medical records into our cloud-based dental record system. It's not perfect at this point, but it's our first step. For me, in particular, working on site, I have to go open the EMR, their electronic medical record, and then I have to open my dental record, and then I have to go through both. No, it's not super efficient. We could do a million
Well,
times better, but it's
oh,
definitely a step towards integration, which is super helpful.
yeah, we literally wrote the standard with the ADA of how to make that happen and implemented it. So separate conversation. But
Yes.
Lisa, thank you so much for being on the podcast. So if people are listening and if they're a hygienist and they want to learn how to expand kind of the care, or if they're dentists or run a DSO or in the dental industry and want to take the sort of, I call it hub and spoke model, that's my words, not yours, and implement it. What's the best way to get started?
I think the best way to get started is to first look into what is your scope of practice in your state. A lot of what I do, I can't do if I move over to a different state, unfortunately. So first starts with policy advocacy and seeing there because otherwise that's a bit of a doorstop. Um, Also seeing, okay, these are my parameters and how can I work within that? Maybe it's adding just simply a care coordinator that's going to aid with that transition into medical dental integration so that there's a better connection there. Maybe it's utilizing something like a community health worker. We have 3 different community health workers that we work with here, and one that's just about to finish her certification. That is essentially that care coordination aspect that's helping to bridge some of those barriers to care. So maybe we can't get into the community yet, but we can have someone that's the bridge. You talked about how it's like, why don't they just come over here? Why seeing what your limitations are and then working with those. You have to be creative. You have to be willing to adapt. I think it's easy for us to stick to the same 9 to 5 patient every 60 minutes model, but sometimes we have to think outside of the box a little bit to reach the communities that need us the most. All those underserved populations that just aren't able to get the care they need. So our community health workers are amazing. They are helping not just connect patients with their care, but they're setting them up ride transportation. They're helping them get set up with interpretive services. Some of those bigger barriers that are making it so it's harder for them to get in.
Lisa, thanks so much for being on the podcast. Very much appreciated.
Yeah, thank you.